In this presentation, we feature Diana Thompson discussing what's new in massage research. The volume of research on massage has increased dramatically over the past 10 years, and the Massage Therapy Research Foundation has provided a pivotal role in this regard. In this presentation, Diana will discuss the role of the foundation and the contributions that the Massage Therapy Foundation and massage therapists are making in the community. You'll learn how you, as a student or a practitioner, can participate in research case report contests, and you will discover the latest trends, findings in current research, and hear reports from 2 grant recipients on their case studies. I'd like to introduce our presenter, Diana Thompson. Diana, as we mentioned, is currently the president of the Massage Therapy Research Foundation and is a licensed practitioner in the state of Washington. She began her practice in Iowa in 1979, working exclusively with college athletes, and became licensed in Washington in 1984, where she founded Lakeside Massage, the Injury Clinic. Diana has taught at dozens of massage schools throughout the United States, including Vassar Naturopathic University and Seattle Midwifery School. She's presented at state and national massage physical therapy, chiropractic, and midwifery conventions and seminars, and has been a consultant for several NIH-funded research projects for the regional national insurance carriers and networks. Her first book was published in 1993, and the 3rd edition, Hands Heal, Communication, Documentation, and Insurance Building for Manual Therapists, was published in 2005. Diana, welcome to the World Massage Conference. It's wonderful to have you here.
Thank you, Melanie. It's very exciting to be a part of this innovative conference. So I'll go ahead and dive right in if you don't mind.
That'd be perfect.
Good. I wanted to speak, as you say, a little bit about the Massage Therapy Foundation. As you'll find, we do fund research. All 5 of the projects that I'm going to specifically talk about today are very current research projects and funded by the Massage Therapy Foundation. But I also think it's good for you to know that we are a resource for research literacy and research education in order for us to really be able to take advantage of the research that's out there and have it impact our decision-making in the clinic and our clients' well-being. It's important for us to be able to know how to find it and read it and integrate it into our practices. So if you'll turn to the next slide, Foundation Mission. We have a very broad scope in the Massage Therapy Foundation. We want to advance the massage practice and information by funding scientific research. We also fund research literacy initiatives, and we want to give back to the community. So we have some community service projects that I'll talk about as well. Some of them have a research component to them. We have a very broad reach. We grant internationally. Some of the countries that we've granted research to include New Zealand, Australia, and Canada. Some of the countries we've granted community service monies to are India, Honduras, and Brazil. And we include all types of bodywork in our scope as well. So we really are trying to be the philanthropic organization for the massage and bodywork profession. The next slide, principles. We've added a principle this year that I just want to point out to you, and that is collaboration. It's really important that we reach out to other foundations, to other organizations, and work together to advance this great profession. It's very impossible to do everything that we'd like to do all by ourselves, given that we're a small organization. So our collaborative efforts are very important to us. So we'd love to be in relationship with many of you out there. And I'll mention some ways that we can do that as we go on. Next slide, foundation goals. The types of research projects that we have funded in the past, it's worth just naming a few. We recently did one on labor and delivery to see if massage therapy could decrease the use of epidural medication. We funded a study on pressure to see how tissue responds to varying depths of pressure. I think we all talk about how tissue responds to pressure. We learn about it in school, and and practice it on our clients, but it's nice to have a little data that actually supports that it's good to start light before we go deep. We also fund survey-type studies. We're looking at massage education and training and different practice habits as well. So quite a broad scope there. We have funded a variety of community service programs, including end-of-life care, infant massage in rural areas, torture victims, and massage for the homeless. One way that we really support research literacy in the profession is with our case report contest that Melanie mentioned a few minutes ago. We have a student case report contest and a practitioner case report contest. It's really important that we think about ourselves as publishers, as writers, as sharers of information, that we learn from each other, that we take that academic approach, not quite that publish or perish attitude, but that it's really expected of us to share information as we make discoveries in our practice, that we can all learn from each other. Some of the topics of the case reports this year include bulimia, scoliosis, and recovery from sporting events. So things that I think we all come in contact with and would love to get some sense of, what someone else might do in their massage practice. We also want to make research available. We've sponsored research conferences. I understand that you heard about the Fascia Research Congress today. We were one of the organizations that funded that last year. We have also already paid our sponsorship fees for next year because we really believe in the importance of getting the current research out to people. We funded an osteopathic manual medicine conference this year where we were able to have a dialogue about nomenclature. What are the terms that we use when we talk about massage, and are they similar terms to what other professions are using as well, like the osteopathic profession, the physical therapy profession, athletic trainers, those kinds of people that we really want to have good dialogue with. Next slide, please. The foundation was founded in 1990. So we've been around for almost 20 years, and we've been funding research since 1993, so about 15 years. And we've granted over $840,000. Last year alone, or this year I should say, this year we funded $100,000 towards research, so we funded 5 research projects. And this year we funded $40,000 worth of community service projects. That was 9 community service projects. And we're able to do this because of all the money that we raise. 75% goes to granting. So very little of that money actually goes towards operations. And that's because of a benefactor that we have that pays for the majority of our operations. So you know that when you give money to the Massage Therapy Foundation, that 75% of that is going out in grants. On our website, we have links to projects, research projects that have been published. So if you need to have help in getting access to research, you can come to our website. We have full text case reports. When they become available, they're posted on our website. And we have a database that has a live direct link to PubMed that has some suggestions on how you can search for different massage and bodywork modalities and research in those areas. We convened and published the Massage Research Agenda, which I'll talk about in a minute, and we've even formed a committee to write a research synthesis on stress so that that kind of information can get out to the public and to other healthcare providers, and I'll also talk about that paper in a minute. So next slide, please. So we fund and promote research not because we need proof that it works, but we already know that. We know massage works. We have very passionate believers in massage in our clients, but we really need the research to help us be better at what we do. I think the more information that we have, the more effective and efficient we can be in our bodywork sessions. It's also critical that we're safe. It's important for us to know if there's any techniques that might do some harm. I am here now in Atlanta, Georgia, at an integrative oncology research conference, and just went to a massage and research presentation, and they spoke of massage over different surgical sites, and in particular bone cancer. Massaging right over the bone that has cancer is extremely painful, and it's important for us to know that, and so that when we're with our clients we can do as little to cause pain as possible. It's also important to have research to educate referring healthcare providers and insurance companies, people that might send us clients or reimburse us when we have clients, and to use research to create jobs. I am also astounded at the level of information that our patients have about their illnesses and the potential treatments that are available to them. PubMed has done much to educate the general public about healthcare, and I have people coming in asking for data. And so it's important for us to be able to find that research and give them the information that they're looking for. And we need to be the ones that critically analyze the research out there. We're the ones that can say, you know, that protocol wasn't really wise. There's no reason to do that type of massage with that specific disease or illness, because it's not what's going to cause benefit. So we shouldn't really pay attention to the results of that study because it's not valid, or maybe the sample size isn't big enough. So it's important for us to be able to read the research and digest it a little bit before sharing it with our clients. Next slide, please. The Massage Research Agenda Work Group. Massage research for so many years was not done by massage therapists, and probably not even informed by massage therapists. So it became evident to the foundation that we needed to have a research agenda. We needed to help the researchers know what kinds of questions that we have about our own practice, about our own profession, and can give us the information that we need to be better practitioners. So we got together a bunch of people, physicians and massage therapists and physical therapists, researchers, people who we thought could give us a very well-rounded outlook on what we might want to pursue with research, and then published the paper that they came up with. And let's turn to the next slide. So the Research Agenda Executive Summary. So what we're really trying to do is encourage research that uses trained massage therapists to do their studies, and not just, I don't want to say just a nurse or just a parent, because I think those are very important people that can supplement the massage. But there have been studies that have shown that massage done by trained individuals is more effective than massage done by untrained individuals. So that was one part that we wanted to make sure happened. We also wanted to make sure that massage therapists were used to consult on the study, whether it was to refine the hypothesis or the question that this research project was trying to answer, or on developing the research method. Is that really the right way to look at that question, and on designing the massage protocol. So is that the right sequence of techniques, or the right way to approach a session for that particular person? So it's important for us to build a research infrastructure within the profession itself. We also think that it's important to fund research into the safety and efficacy of massage therapy. That's a given, I think, in any healthcare profession, the most important thing that we should be looking at. We also want to fund studies on the mechanisms of massage. That's really about how massage works, what's happening underneath the skin, the things that we can't necessarily see when a person gets a massage. We also believe in massage as a wellness modality. It's important for us to have preventative health care and to promote wellness within our communities. And so we want to look at how massage contributes to a wellness paradigm. And we want to fund studies into the profession of therapeutic massage and bodywork. Who are we? You know, why are we drawn to this profession? How do we best learn? And what's important for us to know in order for us to be a good massage therapist? So that's what the research work group came up with, and it's the most downloaded document on our website. So I think researchers are really paying attention to that, and they're looking to see what we think is important to do research on. And in that way, we're really having a positive effect on the research that's being done out there. Next slide, please. So it's not just the foundation who believed in research literacy or believes that all massage therapists really should have some ability to find research and understand it and integrate it into their practices. It's the belief of the National Institute of Health, and in particular their subdivision on complementary and alternative medicine. They state in their strategic plan that really all CAM practitioners should be research literate, and that research capacity should come from within the professions, which really just means that massage therapists, some of us, should be able to actually do the research ourselves so that we're not relying on other people who are not massage therapists to do all the research for us. And I like to think of research literacy as really being, it's about us being curious. It's about us developing our critical thinking skills. So it's important for us to foster that sense of curiosity. So next slide, please. So we're trying to promote research literacy by having our case report contest, by funding research conferences. We're also hosting our own research conference. We're having our second Highlighting Massage Therapy and CAM Research Conference in May of 2010. It'll be in Seattle, Washington, so please save those dates. It'll be May 13th, 14th, and 15th. And the focus of this year's or that year's conference is translational research. Translational research is really taking the data that's out there and synthesizing it into something that means something to us in our daily work, in our practice. And I think sometimes we need a little bit of help with that. So it's good to take these mechanistic studies, or these studies that came out of the Fascia Research Congress. There was some pretty hardcore bench science in that. And how do we take that information and relate it to our body mechanics, or relate it to how we do massage on the sacrum, or things like that. So that's what our focus is. We also have a new journal. It's free, and that's exciting. There'll be a whole session on that, so I won't say much about it here. But we are looking for people to submit academic papers for this peer-reviewed journal. So really think about what kind of information you have to share about the massage profession, either from an educational standpoint or a practice standpoint. So you don't have to be doing research to submit an article for our journal. Next slide, please. We hear the term evidence-based practice quite often, but I want to soften it just a little bit and say that we really are all scientists. That as we collect information in a treatment session, we're modifying our treatments constantly. So we're collecting data and we're responding to that data. So we are scientists, and we are doing our practice based on evidence. That evidence-based is really evidence-informed practice. I hear that said over and over again. It's not just the research data. That's only one part of what an evidence-informed practice is, but it also includes our clinical experience and judgment, and what our clients' desires are and what their needs are. The next slide, please. So in looking at the levels of evidence, there's just a few things that I want to point out before we move into looking at some various studies. The highest level of evidence is considered to be a meta-analysis or a research synthesis, and within that, really the highest is the Cochrane database. They only do meta-analyses on randomized controlled trials, which I'll talk about in a minute. So a meta-analysis, I like to think of it as someone taking a bunch of fractions and making all the numbers at the bottom the same so that you can add up all the numbers at the top. So it takes a whole bunch of research studies and tries to synthesize the data in such a way that you can add it up and compare it and make some generalized statements about things. So that's why they consider that the highest level of evidence, but it's really taking many, many studies and putting all the data together and seeing if the information that we're saying or that those research projects are saying can be generalizable. A randomized controlled trial means that the people in the study don't get to choose, so that's randomized. So if you're comparing massage and acupuncture and exercise, that they don't get to choose which of those they get into. They're randomized into that. There's a control group, so there's some sort of placebo or sham. There's some sort of blinding. People who take in the data don't know which group that the patients are in. So all of that kind of eliminates any bias within the study. A pilot study, which is mostly what the Massage Therapy Foundation funds, are small studies that are really about refining a hypothesis and looking at the possibility if that's a question that's worth investing more money and more people into. And it's a very important part because we can't get randomized controlled trials unless the pilot studies have been done first. And then we have our case reports, which I hope everyone listening to this conference today is going to write up a story about their own clients and submit it as a case report. So next slide. So we're going to look at several types of research. There's clinical research, mechanistic research, integrative research. So the integrative is really the meta-analyses or syntheses. It's taking a bunch of information and integrating it. The mechanistic studies are the basic science. How does massage work? What's happening underneath the skin? And then the clinical studies are really like the efficacy studies. What are the special effects of massage as I apply it? Or what's the effectiveness? Does it actually work? Can I do a treatment comparison of this particular technique on real live people? Quantitative data that comes out of those studies is measurable. Quantitative are more open-ended questions. So we might have a study that quantitatively it doesn't give us any conclusive data. We can't say that it reduces pain, but qualitatively people might say, I just feel like I can live my life again. You know, in this cancer conference that I'm in right now, there's many studies like that where they say, I now have the will to live. I now feel like I have the strength to battle my cancer since getting massage. So it's very significant results, even though with the numbers we can't show that we're reducing pain significantly. Next slide. So integrative research, we did a synthesis on stress. We got together a bunch of PhDs who are also massage therapists. That's kind of exciting to have that combination, and had them look at the evidence. The title is there. It was published in ECAM in May of this year. Next slide. So according to the literature, there are many reasons why we should be studying massage and stress. It's a very frequent reason why people go to massage therapists and seek massage, that people are using massage therapy as a medical approach to their health care and wellness. There was actually a study presented today that NIH did that was just published, And it said that the number one reason people seek massage is for pain relief, but the number two reason is for anxiety and depression. So stress is really right up there. It also shows that herbs are the number one alternative, complementary and alternative medicine used, but that now chiropractic, osteopathic, meditation, and massage are equal practically as a number two. So we're moving right up the chain there, which is great. Next slide. So of the over 1,000 studies that were initially looked at, 25 studies met all the inclusion criteria. And that included massage being a manipulation of soft tissue, that the massage that was being done was done by a trained massage therapist, and that all the studies included some sort of dependent variable on stress. The typical massage was 20 to 30 minutes, twice a week for 5 weeks, even though some studies had as short a massage as 5 minutes and some as long as 90 minutes. Some offered 6 massage sessions and some as many as 22 sessions. So there was quite a range in there, but this was your typical. And that the evaluations were done before and after several of the sessions. So primarily the first one, the middle one, and the last one, it seemed, were the most common measurement opportunities. Next slide. So the findings on massage and stress, first of all, the stress response is the body's reaction to any real or perceived threat, and it activates the sympathetic branch of the autonomic nervous system, which does a couple of things. It stimulates the hypothalamus, pituitary, and adrenal axis, which then produces stress hormones like cortisol, like epinephrine, like norepinephrine. In a positive situation, that's what gives you the strength to lift a car, off your baby that you just ran over. I never know why they use that example, but that seems to be one that people say. So it's got good short-term effects, but the chronic stress is really filled with negative consequences. So the heart rate goes up, it mobilizes fuel, it releases these chemicals, and when those stay in your body for the long term, it creates a lot of stress on your body. So the idea is that massage can reduce the heart rate, reduce the blood pressure, and reduce the cortisol and other stress hormones in the body. Are we on the findings?
Yes, we are.
Thanks.
Thanks for checking in.
Yeah, sorry, thanks.
We're good.
So we were able to, this synthesis was able to say that yes, there is a reduction in salivary cortisol, yes, in heart rate, yes, in diastolic blood pressure. Actually, yes to both systolic and diastolic, but the systolic was a little less significant. Now, the crazy thing is, which is common, I think, in a lot of these studies, the results were not supported over the long term. There wasn't an accumulation of results, but they were repeatable. So that's a good thing. And there just wasn't enough data on the catecholamines, like the epinephrine and the norepinephrine. And one of the ideas on that is that, 6 of the 7 studies that were looked at in this group were done by the same group with no variability of the massage protocol. So perhaps someone else needs to be doing some studies on that. Next slide. So to give you an example of a mechanistic study, this is one on brain activity with massage. It has not yet been published, although the poster of it is available on our website if you'd like to see it. Next slide. So the study was really to look at what the effects of massage on the brain are. So there's lots of effects that can be cited in the literature, like the decrease in stress and stress hormones and increase in cognitive performance, which is very interesting, I think, and muscle tone and range of motion in children in particular, and the boost in immune markers. But we don't really know what goes on in the brain. So this particular study looked at 3 different kinds of touch. So one was a Swedish massage, one was manual reflexology, and then one was touching the bottom of the foot with an object. And they wanted to see if the manual techniques, the Swedish massage and the manual reflexology, had more positive results than the object itself. What was interesting, if you'll turn to the next slide, that all three activated different areas of the brain, and that both types of reflexology had additional stimulus to another part of the brain. We go to the next slide. We don't necessarily have to understand where all those regions are in the brain or what exactly is happening in the brain, but the implications are really interesting. I think in particular for stroke patients, patients with Alzheimer's, other neurological conditions, because what they found was that with touch, there's enough stimulation to change or initiate motor output, to increase cognitive function, and to affect neuroplasticity. So that means learning can be affected, and our adaptability, the ability for the nervous system to respond to various stimulus, can be affected. So if touch is causing a response in our motor circuits, which is causing a response in our cognitive function, it makes me wonder why we sit in a classroom without any contact with other people. So, move around while you're listening to this, and you might gain a little bit more information. Next slide, please. Just briefly, another mechanistic study. The effect of M technique versus massage on brain imaging. This one was just published last month, and it was using SPECT imaging, which I had never heard of before, single photon emission computed tomography. But what I found very interesting was that they were comparing this specific touch protocol with conventional massage. And these people were scanned before and after the first and the last of 10 sessions. So next slide. And are we on the findings, or does that take us to physiological?
Physiological.
Go one more. Sorry about that.
No worries.
Both techniques changed the blood flow in the brain and had brain activation changes. What was really interesting is that the M technique had an increase in response over time, which we have never seen with any of the massage studies that I've seen. It's really fascinating that this one particular technique might have a cumulative effect on the brain. And what I found most interesting, this paper was presented before it was published at the AMTA, the American Massage Therapy Association convention last year. And even though there was this dramatic difference between conventional massage and this one particular protocol, no one seemed to be interested in learning more about the one particular protocol. So I say that just because I think it's important for us to really be open to the information that we learn from research and see if there maybe isn't a better way or a different way of doing things that might get us more results. So please stay open to that kind of possibility. That protocol is available. I believe the researcher even has a DVD with that technique demonstrated. So next slide, please, on clinical research. This is something that we have just funded. The study hasn't actually begun yet, but Win-Win Hands-On is about a Weight Initiative Now research project. The public health implications on this are just tremendous. I think we need, as a profession, to start thinking about how massage impacts public health as a whole. This particular intervention is on diabetes and youth, but there are similar studies being funded by our government and private foundations, I think around the country at least, if not around the globe, on things like asthma and cardiovascular disease and decreasing risky sexual behavior and violence and substance abuse, all things that are issues within our communities. And if massage can make a difference with those things, it could have some great benefit, I think, to our community health programs.
Diana, I'm just going to pass, pass on Eric to take over the hosting. I'm starting to lose my voice. And so he'll come in, and then we'll pass you on to Scott. So here you go.
All right. I hope you feel better.
We're all here. It's all good.
Ah, great. Do I have a couple more minutes to do a couple more slides?
Yes, you do. And then we'll take. We're just going to take a few questions because we don't have a lot of time left. But Eric's just taking over, managing that. So
thanks, okay. Eric. So I just want to say that you can read, if you go to the next slide, so will massage improve well-being and reduce diabetes risk in girls? What we're really looking at here is regular massage an effective strategy to communicate information that will improve the well-being of kids and reduce the diabetes risk? And I think that's a very interesting question because massage has the possibility of conveying a lot of information about body image and potentially increase self-esteem of these kids. And it's just exciting to see this being studied. And the next slide. This win-win project actually started out as a community service project, and I just wanted to give you a couple of statistics that the community service project came up with. So 163 girls participated in the project, and it not only included massage therapy, but before it, after, and during the massage, they got some nutritional education and some physical activity. As a result, 93% changed their eating habits. That's astounding. 79% decreased their soda intake, their pop intake. 79% increased their fruit intake. 64% increased their vegetable intake, and 93% became more active. So what role massage had to play in that, I think, is an interesting conversation. And the last slide, just to bring up one more community service project that had a research component. Camp Amigo is a camp for kids who have been severely burned, and when they tried to go back to school, they were laughed at because they were disfigured by their burns. And so this camp gave them massage as one of their ways of really coping with self-esteem. And it greatly increased their mood and improved their range of motion. So massage is doing great things out there. So that's what I have to share with you today, and thank you for the opportunity. I'd be happy to take some questions.
Wonderful. I have a few questions for you.
Okay.
Well, actually, I have a lot of questions for you, Diane. But we're going to keep it to a couple questions. We have Stephen from New Mexico, and his question is: what is the best way to stay on top of massage research? Is there a single journal or website resource that people should be looking for?
There are a couple that I would recommend. So one is, of course, the brand new journal for the Massage Therapy Foundation, which is the International Journal of Therapeutic Massage and Bodywork. There's a couple of CAM journals out there. The Journal of Complementary and Alternative Medicine is one that I always read, and then there's Leon Chetow's journal, the Journal of Bodywork and Movement Therapies. So those are the three that I don't miss an article in, and there are a few more out there that you might find to be helpful as well.
Isn't it wonderful that we have these resources available today for massage therapists?
It is.
And massage therapists, I'd say the majority of the questions I received were, how can I get involved in doing massage research? I love massage.
Yeah. Isn't that great? Well, come to our website and see what's available. So we try and post a lot of opportunities on there, and we'd be happy to help you get pointed in the right direction.
Well, fantastic.